This hour is going to review Mood Lifters, the Palliative Care Parents Edition. This version of Mood Lifters launched in 2020 as a spinoff of the program that was started 5 years ago by Professor Delden, who along with 3 program participants are going to share with you details of the program and some of the outcomes. Patricia Delden is currently a professor at the University of Michigan in the Department of Psychology and Psychiatry. She got a BA from the University of Iowa and a PhD from Illinois, and was on the Harvard faculty for 9 years before coming to Ann Arbor, where she is currently the Deputy Director of the University of Michigan Depression Center. She's helped to launch the National Network of Depression Centers as a founding board member. She's published nearly 90 peer-reviewed articles on depression, bipolar disorder, schizophrenia, with a focus on the neural correlates of major depression. Dr. Delden and her team developed Mood Lifters and are studying Mood Lifters programs as a potential way to help people worldwide who aren't receiving sufficient mental health care. Her intention is to provide people in pain wherever they are and whatever their means with instant, broad access to effective evidence-based mental health treatment. Her dream is to tap into the work of the world's best mental health researchers and make an expanding set of resources available to improve lives everywhere. You can find a full bio for her on our website, childpalliative.org. She's going to be joined by Teresa Cruz, who graduated from Grand Valley State University with a BA in psychology and has spent much of her career working with adjudicated youth in group settings using positive peer culture as the basis of their treatment and focuses on positive lifestyle changes. She is currently a client success manager for a renewable energy company in Ann Arbor. She's been through Mood Lifters herself as a participant and saw great changes as a result. She will also be joined by Shani Turk. Shani is a public health professional as well as a birth and postpartum doula. Shani discovered Mood Lifters as a participant through the University of Michigan's Palliative Care Parent Group and was inspired to then become a leader with the program following her experience there. She's the mother of a toddler with a rare genetic condition, and she wants to provide support to families of other children with medical complexities. Rounding out the panel will be Nikki Schuler. Nikki is a former school educator and currently homeschooling mom of 3. Nikki's oldest son, 14-year-old Parker, was diagnosed with a rare genetic syndrome over 7 years ago. Nikki was a pilot participant in the first Mood Lifters program for palliative care parents. I want to mention that the sessions for Mood Lifters parents, was funded by the Elizabeth's Courage Fund that made this possible. And there's the slide. They've done now 3 fundraisers to help support programs to help kids and particularly help the parents of kids that are in these categories that we know so well. All right, so I'm going to turn things over to my colleague, friend, and neighbor, Patty Delden.
I was going to say, Ken, you left off the most important thing about me, which is I'm your neighbor.
She's my neighbor.
And that's actually how we began collaborating in some research, and then also came up with the idea. Ken came up to me and said, that Mood Lifters thing you do you think you can do that? And my parents, and I'm so glad he did, because it happens to be, to me, one of the most important things that we are doing right now. So it was supported by the Elizabeth Fund, but it's also the original program was supported by the Depression Center, where I'm deputy director, as well as these other generous donors. So without all that support, our team wouldn't be able to do what we do. So thank you so much for having me. And thank you to my co-speakers for joining me today. So why do we need Mood Lifters? Well, you just heard, it's a really tough battle for folks who are caregivers. And we know stress really contributes to mental health challenges. Now, these statistics are pre-COVID, and I can only imagine what they would be now. I do know that in most people, on average, the mental health challenges have doubled, and 80% of people report feeling some form of stress or depression or anxiety related to COVID. So this number we don't know in parents of kids with, there is no data on parents with challenging situations at home with their sick kids. what the depression and anxiety rates are, but I'm assuming they've doubled. And factors that play a role into their illness are the severity of their child's illness, as well as income challenges, which I think is related to all what we just heard about in the last conversation, in the last talk. And the problem is both emotional and physical health for parents. Parents struggle with being too tired. They have too little energy. They're frustrated with systems. They're anxious for their kids. They feel hopeless that things will change. And often they report feeling helpless. They feel socially isolated. Like she said, get off, get your red phone, I think she called it, to try to help you get this team around you. It's hard for them to talk with nurses and physicians, and the average amount of direct care is 33 hours, on top of if they're trying to work or do other things as well, have other children to care for. It's really exhausting for these folks. Another problem is financial burden. 89% of parents have significant financial burden. And when Ken and I started this, there was no mental health care program that was specifically designed for parents of chronically ill children. And so that's why we created Mood Lifters. Now, this again is an adaptation of the general program, because getting high quality mental health care is challenging for everyone, particularly these parents, but it's challenging for everyone. Why? There are 4 reasons. One is care is extremely expensive. So a traditional sort of ideal set of treatments for depression would be CBT for around 18 weeks. So if you times that by the 9 million people times the $150 an hour you'd have to, I normally bill as an individual therapist, you can see how expensive trying to treat half the US population that will have a mental illness at some time. And then we have a problem with availability of clinicians. It takes 7 years for me to get a PhD, and psychiatrists about the same. And then social workers, it's also a couple years on top of their 4-year undergrad degree. So the availability of licensed clinicians is really challenging. Only half the counties in the state of Michigan, for example, have doctoral level care at all. And many have no master's level or doctoral level care whatsoever. So there's a huge shortage of available clinicians. And then even when when they do get a chance to be with a clinician, only about 30% regularly do evidence-based or science-based care. And then on top of that, even if you have evidence-based care, you have a clinician and you can afford to go, most people won't. They want to do it on their own. Like the person, the speaker before, they don't complain. They want to fix it on their own. That's what most people want to do. So most people, and again, a lot of that has to do with stigma, that I need to do this by myself. I need to pull myself up by the bootstraps. So these are 4 barriers to care in general, and then you can see how they would be exacerbated in this population. Some unique barriers for this population is lack of time, lack of childcare, financial limitations, and stigma. So that's why Dr. Pitich and I decided that we should try to create a program that's specific to this population, that it helps, again, the goal of Mood Lifters, which is a novel mental wellness program that improves mood and helps people thrive. The way we talk about Mood Lifters is, unlike most treatments which were developed for a specific illness, this is a general wellness program that helps people regardless of their psychiatric diagnostic status. So our goal is to help people who are struggling with depression, anxiety become healthy, and those who are stressed or struggling but maybe not have a mental illness, or we get them to not ill, we want to help them to thrive. So this program is for everyone, to get them from depressed and anxious to healthy, and from healthy to thriving, while addressing those 4 A's I mentioned before. So the specific goals for the Mood Lifter program is to increase joy, energy, contentment, decrease depression, anxiety, and loneliness, and improve relationships, physical activity, and positive behaviors. Oops, I'm going the wrong way. So where does it fit in terms of the regular care that you're used to seeing? Mood Lifters is trying to reach the 60% of the population that can't go or won't go or doesn't need traditional care. Or a lot of what we do is also about half of our population has other forms of care, often a primary care doc who's providing them medication, but doesn't have the time to support the rest of their complex needs that they have. And often it's interesting because sometimes when people go through mood lifters, they get well enough that they can then specifically deal with more severe psychopathology, um, such or other kinds of problems that we don't address directly, like marital counseling or things like that. So how I came up with this idea is that one of the things, as I said, every conference I went to, every position that I've been in, every class I have to teach, I have to explain, or we talk about how there isn't enough high quality care. It's too expensive. We don't have what we need for people. And this was really bothering me as associate director at the time of the Depression Center. It was our number one complaint. We have a 6-week wait. We have an 8-week wait. And these people are suicidal and we can't get them in. And supposedly in Washington County, we have enough care. So this really bothered me because I went in this field for a singular reason, and that was to help people. And we were, in a sense, we were failing people. And so I thought we need, I tend to be a sort of a big, I try to think outside the box. I try to be creative, like, how can we solve this problem? And I didn't think just throwing more money at it was going to work, because people have tried that. That would help, but I don't think that would be the answer. We had to think differently. So all this was percolating in my head while I was sitting in a Weight Watchers meeting, right? This is always in the back of my mind. I got dragged there, kicking and screaming my colleague. I thought I could do it on my own. I had stigma about getting help with my weight and so on. But I was intrigued because he dragged me there saying, this is the number one program. It only costs $40 a month. So if you go and it doesn't work, it's not a big loss. And he was a champion of positive psychology, a colleague. And he's like, it's really psychologically sophisticated. And I'm like, okay, I'll go. And sure enough, I'm sitting there in the meeting. I'd lost 35 pounds, feeling very comfortable and welcome in this space, very grateful. And I turned to my colleague and I said, why don't we have something like this for mental health care? Why don't we have something? And he's like, that's impossible, Patty. You can't do this. So that's all I needed to hear. And so so I took that as a challenge. So I went off in a fellowship and essentially created the Weight Watchers for mental health. So it's a low cost, highly effective. So Weight Watchers are low cost, highly effective, and they treat 2 million people a week. And I thought, so what did I do? What did I think was essential? How would I do that? So one of the first and most important things is we know that mental illness has biopsychosocial causes and consequences. It's a complex illness. It has, as I'm a neuroscientist by training, I know there's biological components, but as we see here from the last speaker, there's a lot of stressful life events that just make things challenging. So we know that there's social, emotional components, behavioral components, as well as thoughts related. I love her call. It's like, you go out there and say how great these people are. That's a way of challenging those thoughts that somehow that people who are caregivers aren't doing anything worthwhile, right? So challenge those negative constructs. But anyway, mental illness has a complex psychosocial causes and consequences. And I wanted to cut across both disease and healthy states to help people like these parents. They may or may not have a mental illness, but they're just really struggling with stress and needed some psychological support. So Mood Lifters cuts across disease and healthy states. And briefly, what it's like in Weight Watchers, you weigh in when you go to a meeting, you learn a program about how to eat better or move more, and then you go home and you practice those skills, right? If you just went and talked about your weight, I don't think you'd lose too much weight. You actually have to do something. So I thought, okay, what can I take from this model, both business model as well as behavioral change model? Can I get this high quality care Weight Watchers has in mental health? So before each meeting, people, instead of weighing in, they check in with their mood and they check in with their leaders on whether they have their weekly goals met. Then during the meetings, which are 1 hour a week, now they're online via Zoom and always will be for these parents. They're run by a leader and helper who've been there in terms of in the group, but also from the population in which we're working with. And in this population, it's particularly important. And then each week we cover a new evidence-based topic, which I'll get into in a minute. So everything, in a way, I invented nothing. I took Weight Watchers and the best of what we knew out there in clinical and psychology, social work, and psychiatry, and put it in a program. Then each week they end by setting individualized goals, personalized, and then they have to gain points for meeting their goals. So in Weight Watchers, you might get a goal of like 30, and you have to eat under that number of points, and say a donut's 15. You try to get under. In Mood Lifters, what we do is you try to get you to do healthy behaviors, and we try to get you over the number that we set for you. So peers makes this affordable. Peer leaders makes this affordable. And then in a group also makes it affordable. So people often ask, can peers really do mental health care? The answer is absolutely. And actually, Teresa and Shani are probably better therapists than I'll ever be in my whole life, because they're amazing. We get so many compliments about their skills, but also more importantly, we have data to show that they're equally effective. In the field, we knew this. There's already, and this is sort of an unknown thing, that if you give manualized care, peers are equally effective to professionals. For the participant, it increases their feelings of empowerment and self-esteem and self-confidence and empathy and acceptance to be with a person who isn't above them, who is their peer, who has struggled with the same things, and can actually give them skills to help solve their problems. And I think this, in this population in particular, I've had parents tell me that they've tried therapy and they found it not very helpful because those parents have never been through what they've been through and they don't get it. Whereas our leaders get it because they've been there. So it seems to be more acceptable for them. And again, it helps us with the accessibility, availability issue, because it takes less time for us to train peers in this program than it does to get a PhD, obviously. So the meetings, what do they cover? Again, remember, we want the biopsychosocial. So we have 5 different topics that we cover meetings, everything within this, the first 15 meetings. And we stopped at 15 when we developed this because we wanted 3 of each meeting. It's not a magic number. And in fact, we're going to eventually have enough meetings where we continue developing new content, because we have about 180 other ideas of meetings we'd like to do. Like Weight Watchers goes on continuously, we'll eventually go on continuously. But for now, and we've sort of stopped here because it works so well, we have topics that are in the bio domain, the biological domain, the cognitive domain, the emotion domain, the behavior domain, and the social domain. And again, all of it is based on evidence-based strategies that are known in the literature. For example, so how does this work in real time? So the very first meeting we do for everyone is behavioral change. Behavioral change is based on CBT, and which we know that we learned that although changing thoughts in CBT is really important, it's the behavioral activation piece that is really the active ingredient, or the most active ingredient in CBT. So meeting number 1, we teach them that, we call it healthy behaviors. And we tell people that what they need to do is positive, either meaningful or pleasurable activities, because that's the number 1 thing that will help people feel less depression. And again, it's based on really solid science. So in that meeting, we teach them about it. We teach them what that means. They get to decide what will give them real pleasure or real meaning in their life. We don't dictate what that is. And then they have to do 5 of those activities. It could be walking your dog with your neighbor, like me and Ken often do, or me and Ken's wife often do. It could be having a piece of chocolate. It could be enjoying that first cup of coffee. So I challenge all of you, if you're not feeling so good these days in the pandemic, start out with this very simple task. Try doing 5 pleasurable or meaningful activities. Make time for yourself. And parents will say, oh, I can't do that. I'm too busy caring for my child. But we work with them to figure out ways that they can incorporate that into their life. Okay, so this is the version that it's slightly changed from our regular adult version. Like we have self-compassion that we've added and so forth. So we've taken out one of the sleep. What the beauty about this is it's modular. So that first group we were running, that Teresa was running with Nikki in it, they're saying sleep. we could sleep if we had the bells, like that was such a great idea. If we had time, it's not about prompts of sleeping. So we immediately, before we even got to the next sleep session, took it out and replaced it with self-compassion, which is another evidence-based strategy. So we're able to modify this program based on what population we need. So this is what we have done since the beginning, this group of meetings. And then how do we know it works? Prior to when people start the program, before meeting one, we ask them to fill out measures covering 6 areas that we just discussed. I pulled out sleep because sleep is particularly important. I'm a sleep scientist, for mental wellness. And then we test them between meeting 14 and 15 again. And then we give them feedback on how they're doing within these 6 domains. But we also keep the data so we can make sure that it's working. So the question is, does it work? The answer is yes. So first I'm going to talk about, oh, I realized I didn't update this last number here, but I will. It's been 4 small pilots and we have about 40 parents now. So first we did a pre-pilot in our lab, then we did a regular pilot group, and we had to do a pre-pilot for us because everyone who runs Mood Lifters as a leader has been through it themselves and identifies as a peer, including myself. So when I can run Mood Lifters meetings, not because I have a PhD, but because I've been through it and I found it helpful. Then we did a pilot group and then 5 groups in a row where we got feedback from people, where we improved the program based on their feedback. Then we did what's called a randomized control trial, which in my field is the gold standard on how you determine whether something is helpful. In this case, we ran 3 groups. We ran those people who were in groups with peer leaders, with professional leaders, and then in a wait list where they got no treatment. And I'll show you the data in a minute. We've now run nearly 1,000 people in the group, overall in all groups. And we've done 4 small pilots of parents with about 40 people. So this is data that I'm going to show you that's for the general adult program first, because we have a lot more data. This is on over 400 people. And what we have found, and so this is a little bit complex. So for COVID anxiety and pre-COVID anxiety, what I mean by that is it's during COVID or before COVID hit. Now it's confounded because pre-COVID, we were in person and there was no COVID. And then during COVID, it was online and during COVID. So when I first separated this data, I was very worried that a lot of our results would go away. My goal was just to try to help people stay stable with their mental health. I never thought we would actually be able to really help people during this horrible time. If we could have just maintained mental health, I would have been happy, but that's not what happened here. So in my field, what you want to see as a clinically significant result, meaning people will feel a difference and people around people will notice a difference, is a 25% improvement. 50% improvements are almost unheard of in my field with behavioral therapy. And what do you see here? So pre-COVID anxiety, right here, that means in person, we saw at least a 30% reduction. And here you can see during COVID online, we have a greater than 50% reduction for depression and almost a 50% reduction for anxiety. And you can see we also had a lot of improvements pre-COVID as well. This is a positive psychology. So again, flourishing, it says that's short for flourishing in our lab. And what you see is during COVID and before, we increased flourishing in addition to decreasing these negative states. This is, we decreased social functioning problems significantly by more than 50%, increased positive affect and decreased positive affect. Now it's important to note, when I first thought of this therapy, of this treatment, I thought of it as mainly for people who were sort of like therapy light, who weren't very ill, but what we're finding is the greatest results in people with moderate to severe illnesses. So what about parents? So we've run about 40 parents. We have the hardest time getting these folks to fill out the forms because they're so busy and stressed out. So we only have data on about half the people. So the first important thing is it acceptable to people? So we just want to know, how likely would you recommend this to people, and how useful did you find this to be? And that you can see people they would highly recommend this and find it to be very useful. So 1 is not recommended and 10 is recommended completely. And same for usefulness. And what did they say? What did they find helpful? Because at the end, when we gave them that second battery of tests, we asked them for some feedback. What did you find helpful about the program? All of it. It was very helpful. It's helpful to share common struggles. They like practicing actual attainable goals. There was a good community, being able to connect with one another, being validated, learning tools to take care of themselves and their children. And one parent said to me, you know, self-help groups can be, so they're concerned if their therapist doesn't have the lived experience. They feel like they can't really relate to that person. Then when they go to a support group, they really feel like they don't, it just sometimes can devolve into just a complaining and not sure what to do about things and things like that. And so that what she said to me, that's what she told me, which I've never been to a support group for this, so I don't know if that's what it's like, but I trust that's what it's like. But she said, what's so different about mood lifters is you get the support of people who've been there, but then you get actual tools and strategies to try to, with a very program, sort of like a clear program of how to actually improve your situation. So then we thought, okay, because we always look at our data with people who start out. So the first top is depression, the bottom is anxiety. These are where people start. So are they healthy, in the moderate range of illness, or in the severe range of illness? And what you can see for these parents is, again, both in the moderate and the severe range, we see a dramatic reduction in depression, as well as anxiety. I was very happy to see this. And this is where they end up. So do they end up with no illness officially? Like there's a cutoff of 6. So do they get into the healthy range? Do they start in the healthy range, and where do they end up? So for example, people, we only had 5 of 19 people, in this case it's 16, 5 of 16 people in the healthy range. By the end of Mood Lifters, we had 11. So we had no more people in the severe range, and we were able to move pretty much everybody, almost everyone, down a category, which is really important. It's one thing to see on average, but to see people going from severe to moderate, from moderate to healthy, is what we're really looking for. And that's true for anxiety as well. Does this, I'm not sure, does this make sense? Okay. So we think we have solved some of the, potentially, partially, again, it's not a solution, there's not a one size fit all, but we think we've added to the field quite a bit, especially in this population where they had no evidence-based care before this, that we think we've solved problems around lack of time in childcare. How? Because it's on Zoom, this will always be on Zoom. So people can be watching their child, often in the room, their child will be there, or they might be in another room, or they might go to physical therapy and have their phone with them and be on the meeting so that they can actually have time. Because we know these parents were, are much less likely to want to take the half-hour drive to their therapist, their hour for their therapist meeting, and then their half-hour back. They're just less likely to do that. So if we can compress that and cut that time in half, they're much more likely to do that. They don't have to worry about childcare, they're at home. And again, financial limitations, this we're able to offer right now for $12 a meeting, which is just kind of remarkable to have these kinds of results with that cost. Again, it helps with stigma because we have peer leaders and everyone in the room is going through a similar situation. So that's the basic problem. And so then what's going to happen next is Nikki was in this first pilot program, and she's going to talk about her experience with that. So Nikki, are you here?
Yes, thank you. Good morning. I'm here. I'll just talk briefly about my experience in Mood Lifters. I'm going to go backwards just for a second and talk about just who is in that picture. That is my son Parker, who is much bigger than that now. He's 14. And I remember the day that he got his first of many, many, many diagnoses to come. We were in a room. It was the only time ever in Parker's whole life, all four of his grandparents were at the hospital, and they were all at the hospital at the same time. And wouldn't you know, that was the day the doctor came to tell us that we had a life-altering medical condition. So I'll never forget looking at the circle on the door and the doctor knocking and looking at his face and thinking, my life is never going to be the same once this door opens, and it was not. And I remember the doctor came and he talked. Of course, I don't remember a thing he said. And then all four of our parents started crying. My parents, who are divorced, my mom turned to my dad, who had an intellectually challenged brother, and said, "This is all your fault, Tom." And I was like, okay, I need to get out of this room. Now I got my mom's blaming my dad. All the parents are crying. Like, in the meantime, Parker had gone through all this testing and he hadn't eaten. And I was like, "Can Parker eat now? Because can we feed, you know?" So I remember saying to my husband, we got to get out of here. So we left all the crying, now fighting grandparents in the room, and we went to the chapel. And I remember I sat down next to him and I turned to him and I said, "We're going to need a lot of therapy." and I was right, because we were going to need a lot of therapy. But literally, the first thing I said after my child was diagnosed is, "Wow, we're going to need a lot of therapy." So, but that therapy did not exist 14 years ago in any way, shape, or form. We did not know, either did a real diagnosis for our son. So we got a lot of mini diagnoses along the way, but there was no real diagnosis. By time, which adds to this, right? Because we have no idea what's happening. Why is our child so sick? Why am I in the hospital again? Why is he throwing up? Why is Parker screaming? I don't know. Does anyone know? Nobody knows. Okay. So this went on for like 4 years, where we just were back and forth. I think Parker was hospitalized almost 90 times before he was 4 years old. I was still teaching as a high school teacher at that point because I had the good health insurance. So it was not a choice for me at that point to quit. So I was trying to keep my classrooms going and keep Parker alive. In those times, he was not sleeping at all. We held him around the clock because he was in so much pain with his GI system, that we just held him. I mean, that's all I knew what to do. We didn't know what to do. So I held him, I walked him, we rocked him. My husband and I did not sleep in a bed for 4 years. We slept holding Parker in a chair for 4 years. So my brother, in the meantime, was getting his PhD in political science, which sounds like it doesn't relate. But one day he called me and he said, "So we were studying torture the other day, and I thought of you because we were talking about what do people use to torture people in other countries." And he said the two main things they listed were not letting people sleep and playing tapes of crying babies. And he said, "So don't think you're crazy, just know that you're basically essentially being tortured." And that really was what it felt like. And in the meantime, the situation with Parker at times was so severe that people in our life started to go away, right? Because there's only a couple people that really want to say, "Yeah, I'll totally sign up for coming over and holding your very ill child with a tube that's going to, cry and potentially throw up on me." So the people in our life who are all wonderful people, but didn't know better. And were so afraid, by the way, they told us later, I learned this, that they were so afraid something was going to happen to Parker, they just couldn't come into this journey where they were going to connect with a child who they might not see live past 5 or 6, etc. So I finally said, we have no people, I have no diagnosis, we got to figure this out. So long story short, I met a nun who was a psychologist, and I said, we got to start some kind of a group. So we did. And for all the reasons that we just talked about, it failed, right? Nobody could come. Everyone always had a sick kiddo. I mean, you name it, everything that we just talked about happened in the group. So it was a great group, and we tried really hard, and it completely failed, and we all went our separate ways. We still talk, but it didn't work out. And so then which is why, so all this brings me, this whole background, to why I was so excited about being a part of Mood Lifters. Because in the meantime, one of my passions has been talking to people about the mental health of special needs parents. And, just everything that was just talked about, I'm going to talk about in my own real life, right? So when we're on those calls, there is something about connecting with the other parents that it can be very funny, by the way. This journey can be very beautiful and very funny. And there were a lot of times where there was actually just a lot of laughter. And that's just not something you can get anywhere else, because when I go out with my typically functioning children girlfriends, I try to tell them stories that I think are funny about my life, and they don't laugh, right? Because they think it's sad, or they think it's, oh my gosh, how do you do that? Or how do whatever, but it's funny. And it was so great because we could laugh about these these things, and someone could say, oh, I was up all night because my kiddo's feeding pump went off all night. Everyone was like, oh my gosh, yes, I know, I did that too. So, and there's not an audience for that, anywhere else. So I found that so healing. And I think that's the word that I'm going to leave you with the most, is that there's all these different levels of healing that are possible within this journey that then bring you to a higher level of being able to care for these children in a more loving way. And so there was great healing for me that took place to be in a group of people who could relate. There was great healing that took place for me in a group with a leader who totally got it and understood. You really just cannot understate that. I mean, we're all human, and whether you like to admit it or not, it's hard in your head when you're going through this to be like, okay, so that's hard, but let me tell you about some of these other things that I've seen and experienced, right? When we have a sick child, and a child who you think might die, it's, those are some tough life experiences, and you really want someone who you can say, okay, you've been there, so I can heal with you through some of this pain to get to a higher level of being a better caregiver, parent, and human. And the self-compassion piece that was just talked about, that was so huge. For me, I was further along in this journey when I started to take mood lifters, but the self-compassion piece was really inspirational and very eye-opening for me. It was like, oh yeah, I totally have to go back and forgive myself for the time I forgot to buckle Parker in his wheelchair and he fell out at Disney World on the ground, right? And that's like one of 20 things that I didn't realize probably 200 things that I think I needed to go back in my journey and say, I need to have a little bit more compassion, but I didn't know then what to do better. And then I still have this beautiful child who's with me to celebrate, even though I didn't get it right all the time. That was huge. And so I am so excited about this program. The former journalism high school teacher in me was like, can we sell bagels? Like, what do we need to do, right? Because this is the only thing I have. This is my background. My background's like, we got to make this work. Do we need to sell bagels? Do we need to sell Valentine grams? Like, this is what we did in high school to make money to get programs to work. So if I could sell more bagels anywhere to get people to pay for this program, to offer this to parents, I would do it on the side of the road. I think it's so impactful, so important to get parents' mental health right away. My husband also was a participant in the group, and the thing he kept saying is, gosh, I just think back like about how much you just didn't have and how much this would have helped us, all those years ago with Parker, and that we really had to scrape for our own mental health along the way. We really did, and that just would have changed our lives. So that's part of why I'm so passionate about it. The other thing is that this journey changes, right? So I was talking a lot to our team the other day about how Parker's older now, right? So there's different challenges. All of a sudden, I can't lift him anymore. That's a huge grieving, mourning situation that I have to go through. By the way, like all of our, kiddos, parents, friends, and all the people that we raised our kids with, all their kids are going to college now. And so all their kiddos are going to be gone in 4 years, and they're going to be empty nesters. We are not going to be empty nesters. And by the way, I'm secretly kind of excited about that because I love Parker so much. I'm so excited that I get to keep him like for this long. But then there's also kind of like, oh, wait, so everyone's going to be an empty nester and I can't lift him anymore. Oh my gosh, how are we going to do this? I wasn't prepared for this. So it's a whole nother level of mental health support that I'm needing in a new stage with Parker. And I think that's everything I have to say. Yeah, I think I always end with this. My favorite quote from one of my favorite books is The Memory Keeper's Daughter. And there's a great quote in that book that I have up, and it always says that you may have missed a lot of pain, but you also missed a lot of joy, right? So I think it's so possible to get parents with kiddos like Parker and so many others to have a lot of joy. And so I think this program is just such an important step to do that. And Patty and everybody else, you'll be so excited to know that I got like 100 points today for mood lifters because we are leaving for Disney World as soon as this call is over. So I think that probably gives me like 100 points in the mood lifters thing to do as many pleasurable activities as we can. So thank you for having this program. It's just so brilliant. Thank you, Patty, for creating it, and for everyone else for making it work and supporting so many parents like us.
You get social, behavioral, all of it. That's great.
I got it all, everything.
Got it all. That's awesome. Okay, so as I mentioned, everyone who's a Mood Lifters leader has been through the program. And so Shani is our first parent who has made it through the program and has become a leader. We have other ones in the pipeline. So Shani, can you talk about your experience?
Sure, I'd be happy to. Can everyone hear me all right?
Yeah.
Great. Let me just start off by saying I am just so delighted to be here and to be a part of this panel and to be sandwiched between such incredible women. Nikki and I were also participants together, and as you were talking, Nikki, it sort of reminded me of one of the things that I love most about Mood Lifters is this sense of sort of intergenerational community. And I remember learning so much from you as a fellow participant and hearing about your strength and resilience. And I was quite moved even just today about your story. And yeah, so it is truly a wonderful program. And I think one of the things I love most about it is how I'm able to connect with such other inspiring, resilient people who have experienced some version of the hell that my family has also been through. So I'm Shani Turk. I am actually calling in from East Lansing. I am a native to the East Lansing area, but have spent a number of years living outside of Michigan, and frankly did not expect that my family would be rooted here for as long as we are, but life throws curveballs at you all the time. So when I got pregnant with my first son, we did decide to come back to Michigan just for maternity leave was the plan. And then we were going to continue on with our lives, probably move back to the East Coast where we had a lot of roots and community and had lived before. And I'd had a very routine pregnancy and everything looked really good. And as soon as my son Ezra was born, we quickly realized that everything was not okay. And he was medically evac'd to the University of Michigan. And that started us down maybe 4-month path of trying to figure out what was going on. He had a number of sort of genetic abnormalities. They couldn't figure out what the diagnosis was. Eventually, he was diagnosed with a mosaic version of charge syndrome. So essentially a very rare version of a rare syndrome. He didn't meet any of the clinical presentation for typical charge, but he did have a couple other anomalies and sort of the gene that was linked to the condition. And so they were able to make the diagnosis based on that. And I mentioned our backstory of sort of having traveled so much and not wanting to necessarily be rooted in Michigan for a while. And my son, after a 3-month NICU stay, came home with a trach and a feeding tube. And my husband and I had no idea what we were doing. And frankly, didn't even have a stable place to live. We lived with in-laws for a while because we were planning on moving, and all of my maternity leave had been sucked up in the NICU. So aside from the health issues, it was an incredibly traumatic experience for all of us because so much of our world was really destabilized. And we didn't know what we were doing as first-time parents. But there was just so many additional curveballs, and we didn't have the resources we needed not only to figure out this new lifestyle, but also care for ourselves. And I just in full transparency have a history of mental health issues and particularly anxiety. And so this was like a perfect storm for my anxiety to just totally flare, right? Uncertainty, unpredictability. I had no control over my life or my day-to-day. And I feel really lucky that the University of Michigan has had such a great, supportive, family-oriented care system. So in the NICU, I was able to connect with psychologists who were on staff and could just on call come and chat with me when I was going through really difficult times when Ezra was in procedures or whatever. And then we got connected with the palliative care team who recommended this Mood Lifters program. So once we were home and things were a little bit more stable, I joined a group. And reiterating a lot of what Nikki has already said is that I think it was wonderful to be able to have a clear, concrete program. Like I have been in therapy. I am a big proponent of CBT therapy, and it has been really helpful for me. But I do think in these particular issues that we were facing, it was so difficult to be able to find comfort or support in that more traditional model because no one got it. No one could get it. And all of the resources and things you're typically supposed to do just were not feasible, right? You're supposed to get good sleep, and my son has a trach and we didn't have nursing. So sure, sleep at night. That sounds like a great idea. I wish I could do that. And so having parents who were a part of this and had knew that lifestyle and could talk us through sleep habits in a way that didn't feel, I don't want to say condescending, but like out of touch with our reality. Like, what can you do to build in time for yourself, given all these stressors? We know that you can't have a regular sleep routine. So what little things can we do to make things just a little bit more manageable or help you get a little bit more rest? And I just felt like that approach, I felt heard, I felt seen, and I was really able to connect well with the other parents. And so I loved it so much. And I will say that our experience, we have been very fortunate, and I have learned in part through Mood Lifters that there is such a wide variety of experiences. We all have commonalities, but there's such differing levels of severity. Fortunately for us, Ezra has a pretty mild version of this syndrome. And so once he was able to be decannulated, and we were able to take the feeding tube out, he has really been able to thrive unencumbered. And I am so deeply grateful for that. And I also felt like I really finally had a little bit of space and time to be able to try to give back to this community that had helped me so much. So I started off as a helper and was under the tutelage of Teresa, who I can't speak highly enough of in terms of a teacher and facilitator. I learned so much from her, from that experience. And it was really lovely. And I wanted to be able to give back in a sense. But I think one of the things, like, I always learn best by being able to help support learning for others and teach others. And so I think one of the things I loved most about being a helper and then eventually a leader was that it helped me sort of cement some of the principles and strategies that are taught through the manual, and also continue to learn and grow and process with other parents. So like I said, with Nikki and with Teresa, like, everyone is at a different phase in their lives and in this journey with their children. And I was a young mom. It was my first child. I didn't know what the hell we were doing, excuse me, but like, we were so clueless. And it was so helpful to be able to be with other parents, even parents who have adult children and have been dealing with this for a number of years, to learn from the wisdom and the resilience that they have just experienced going through this. Like, really, their adversity, I think, brought so much wisdom and insightfulness that helped me also process and work through some of the trauma we had been through as a family. So I sort of, my last stage of this so far has been to successfully lead one of these groups, and I found it to be the most rewarding experience to date. I really loved it. I hope to continue in the program in that capacity. And yeah, would just encourage, I really like Nikki's suggestion about bagels or drives or something, also grant applications or whatever that needs to happen to be able to help keep this program moving and available, particularly for this population, because there is such a critical need. So thanks again for letting me share my story with all of you.
It's been so amazing having Shawnee. We're so grateful to have you as part of our program. And I'm just going to embarrass Teresa a little bit. Recently, I'm working on now building this into a company so that and again, I don't make money from this. I have no plans to make money from it. My goal is to try to do what Weight Watchers does and treat 2 million people. And so our business model is to get 400 Teresas. So you'll see in a second why we think that. Okay, Teresa?
Thank you, Patty, and thank you, Shawnee, and thank you, Nikki. It's wonderful to see you both again. So thank you, everyone, for having us. I actually, in fact, I don't think Patty knows the story. I was brought to Mood Lifters by my son's critical illness. It was way, way back in the day, before Mood Lifters was even thought of, or even a thought, Patty and Weight Watchers. I was actually in the craft room on the pediatric cardiac unit at Mott's Children's Hospital. And I had taken my son down to the craft room with his drainage tube, his chest tube, and his wires and all of his medical equipment. And we were down in the craft room, and a social worker was there. And the social worker simply sat down and started helping my child color. And this was such a relief for me. She was such a godsend, because I thought to myself, I can take a moment, I can take an emotional moment to just kind of regroup and relax. And it was at that point that I looked up at the wall in the craft room and saw a flyer that said, "Do you want to give back?" And in those days, the little flyer had a little tear piece that you pulled off and you called the number on the little tear piece. There was no QR code, nothing like that. There was no website to go to. I just teared it off. And I thought one day I will be able to give back to these wonderful people, caregivers and healthcare workers and social workers that have helped me and my child. So fast forward 21 years later, I had them when I was 10. No, I'm just kidding. I didn't really. But fast forward 21 years later, and I received an email from the University of Michigan. So what that tier sheet was I signed up for research studies, and you were able to sign up for research studies in several areas of the university. So the university had the business department. I signed up at the business department, the hospital, of course, the School of Dentistry, which was by far my least favorite, but that's another story. And then the psychology department. And the psychology department sent me an email that said, would you be willing to participate in a 15-week course that assists people with their mental health? And I thought, for goodness sakes, absolutely, I'd love to do this. So great way to give back and would benefit me as well. I happen to be going through a particularly difficult time. My company had just closed its doors. I found myself for the first time in most of my adult life to be unemployed. And I thought, this is just perfect. It came to me at the perfect time. So I went through the 15-week course. It was fabulous. I actually, and I didn't think that there was going to be a whole lot of room for improvement. I thought maybe I might improve a little bit. But from the first week of the course to the last week of the course, the data came back and it really, really surprised me. My positive emotions increased, my negative emotions decreased, my depression decreased, my anxiety decreased. I even found myself flourishing, improvements in my flourishing. And I thought I was meant to be a part of this group. So sure enough, once I finished the course, I actually asked me to go through the training to be a leader, which I did. That was actually 4 years ago in January. So in January, it will be 4 years. And I actually became a leader. And I was a leader for, Patty, was a couple of years. So I joined in 2018. And at that time, Patty doesn't know this, but at that time, I thought, gosh, if we had only had that when Jaden was going through all of this medical difficulties, if I had only had that when I was sitting in the ICU with my son for hours on end, if I had only had the support when my marriage failed because of this medical condition, if I'd only had this support when we were going through these difficulties, how wonderful would that have been? And lo and behold, it wasn't but a couple of years later that Patty came to us and said, I met with Ken, we're thinking about doing this group. And Patty didn't even realize at the time that I had a medically complex child. And I immediately raised my hand and said, I have to be a part of this. Please, please let me be a part of this. So sure enough, we started the groups. And like Shawnee mentioned, we had a couple of meetings on sleep. And I remember all too well that sleep was kind of a dream that was out there a ways. I knew I wasn't going to participate in sleep for quite some time when I was going through it. But it was delightful to kind of learn those skills and techniques, but then also to have the self-compassion class brought in. It's amazing to me the impact that we've had on parents. There are a couple of parents that have joined our classes that whose children have passed, and the bravery shown by those parents and the contributions of those parents was so essential and so helpful, and just we were so incredibly grateful. We had another parent, Shawnee and I did, that was participating in the group and had been an avid participator and missed a few weeks in a row. And we weren't quite sure why, and we're a little bit worried, of course. But after those few weeks, she came back and she said, we've put my son on hospice, and she talked about his comfort and his care and his comfort items and all that it meant to work with hospice and her son. And she said, and I had to come back to this group and I had to tell you all and I had to share it with you because I knew you would understand. And she said, and I had to come back to this group because this is my lifeline. This is my lifeline right now. And when you have a parent that tells you, you're their lifeline, this meeting is their lifeline and that it really impacts their life, it changes you. It changes you in ways that you will forever impact me and my life going forward. So I'm so grateful for this opportunity. You will find in the 15 weeks, there are different meetings that speak to people differently. I jokingly always say the apologizing meeting, I didn't have a whole lot to learn because I've had a lot of practice apologizing. So maybe that was one of the meetings I didn't quite hit, but the thinking traps, the CBT, that was very impactful for me. I do love the sleep meetings. And I found that I always referenced it as maybe vitamins, that we don't replace traditional forms of therapy, but it's almost a vitamin to enhance this sort of thing. My daughter, who's actually now a Mood Lifters leader as well, she refers to it as another tool in your first aid kit. It's an addition to the other tools that you have for your mental health. So I'm so grateful to be a part of this. I'm so grateful to have touched so many families. I think back to that social worker that was helping my son and helping him to color and the ripple effect that had. It gave me a moment's reprieve. And from there, I found my way to help other families. So I'm so grateful for them. I'm grateful for the parents who call from the hospital. Patty mentioned that we had a parent that all 15 weeks, she joined from the hospital room and on her phone while her son was in the hospital. And yeah, it's amazing program. It's an amazing program and one that I'm so grateful to be a part of. And for me, I hope to be a part of this and be able to share this with many, many more families to come. So I think that's my time. Thank you for asking me to be a part of it. Thank you, Patty.
Thank you. And the things I didn't mention that both Teresa and Shani mentioned is one of the best way to help your own mental health is to help others. It gives you, and it's the biggest joy in my life as well. I'm still a Mood Lifters leader myself, to be able to help folks help themselves. It's very different than traditional care. We help people help themselves. We don't impose on them. We believe in their strength and their skills and how amazing and awesome they are, like the first speaker mentioned. So it also helps the parents, like Shani was talking about continuing her skills. When I'm leading Mood Lifters, I remember to do my own points. I wrote the damn book and I don't remember to do the things it takes to be healthy, right? But when I'm in my group, it really reminds me that's what the points do. So thank you, all three of you. So we think we've created an accessible, affordable, available, and acceptable program. This is one of our programs. We've also developed one for teens, kids, seniors. Actually, these were developed by colleagues who are experts in these areas once they learned about Mood Lifters. We're doing in trial right now is athletes, graduate students, and young workers. And we're working with Blue Cross Blue Shield right now, hopefully, to develop a palliative care for adult version, combining the senior, adult, and then this caregivers. And also just got University of Illinois just hired us to do this for 500 undergraduates. And then we're also, surprisingly, because we take all comers, we had people with bipolar disorder join our group, and they have also, like the palliative care parents groups, there's no evidence-based treatment that really helps reduce the depression and anxiety. And we found that the self-reported bipolar patients found a significant reduction. So we're now got a donor to give us money to help develop this program. So we're very excited because, again, this is a general wellness program that should help everyone. So thank you very much, Ken, for this opportunity. Thank you for the Elizabeth Fund to donate this, and for your vision, Ken, and your heart for really caring about all these people in a way. I know him personally, and this is really who he is just an amazing person and a really true caregiver and a great healer. Thank you, Ken.